There's a nationwide health epidemic that's derailing some couples' plans for a family, and it starts with what you put in your mouth.
Turns out as prospective parents put on the pounds, they lower their chances of conception. ABC News Channel 20's Natalie Sparacio has more on the effect obesity has on infertility. Here's her special report.
When I went into the fertility process, obviously it wasn't healthy for me as an adult to be overweight, no less trying to get pregnant and have a child and carry that child and be obese.
But look at 36-year-old Jessica Burke now. Hard to believe, just 2 years ago, she weighed 100 pounds more. Like a lot of women, she underwent in vitro fertilization. Today, she has a 2-year-old son, Finnegan.
But once I had him, it made me want to change myself, to be more healthy. I was getting older, I am older. And I chose to go kind of a drastic route.
So that's when she decided to undergo gastric bypass surgery. Jessica battled a weight problem her entire life, a problem that poses serious challenges when it comes to conceiving a baby. Dr. Ricardo Larete Mola, the chairman of the SIU Fertility and IVF Center, says weight directly affects fertility.
First of all, women with obesity can have a variety of hormonal abnormalities. So, for example, women with excess weight can't ovulate on a regular basis, and frequently that interferes significantly with conception. In addition to that, women who are obese have eggs that have abnormalities.
Jessica admits she was a morbidly obese mother-to-be. She knew she needed to take control.
It was hard on me, it was hard on my heart, it was hard on my breathing, especially as the baby grew and I grew.
This mother, 38-year-old Michelle Eads of Springfield, can relate.
My doctor has said that if I would lose some weight, that it would help tremendously getting pregnant.
To make matters worse, while battling her weight problems, Michelle was also diagnosed with polycystic ovarian syndrome. It's a hormonal disorder common in overweight women that leads to cysts on the ovaries, making it difficult to get pregnant. After several rounds of infertility treatments, she gave birth to her miracle baby, Carter.
When you look at the effects of age on fertility, women lose a little bit per year every year. But when you lose weight and you get your BMI from 37, 38 under 35, you get a 50% increase in your fertility.
It's not just women we're talking about here. Men's weight affects their ability to have kids too. Fat cells convert testosterone into estrogen.
They actually have difficulties with erections. They have problems ejaculating. They have problems with a very low libido.
So bottom line, lose the weight. Jessica had to do it the hard way, but now she has her son, so she wouldn't change a thing. But you can. In Springfield, Natalie Sparacio, ABC News Channel 20.
Aside from difficulty conceiving, overweight moms are at risk for gestational diabetes, hypertension during pregnancy, known as preeclampsia, and sometimes induced labor. Experts estimate by 2030, more than half of Americans could be obese.
Your world news is coming up, including details on a tragic train accident during a